Hi, everyone. This is Steve. And for those of you who don't know, I've entered the DBS protocol at Norton's Hospital. DBS is deep brain stimulation. It's a treatment for Parkinson's. It's not a cure. It helps manage symptoms, most notably tremors and movement issues. This started when back in April at my neurologist, Dr. Phillips, my regular appointment with him indicated that he thought I would be an ideal candidate for DBS. At that point, I wasn't quite ready to to be strapped down to a table, put my head in the vise, and have two holes drilled in my skull. But that's pretty much what the procedure is. It sounds scarier than it is. If there is such a thing as routine brain surgery, DBS comes pretty close to that. But as time went by, I reconciled myself to the actual surgery, and my medication became less and less effective. So, for those of you who have Parkinson's and are taking carbidopa levodopa, at present I'm taking 4 times a day, 25 250 tablet, the blue pill, usually like 7 a.m., 11 a.m., 3 p.m., and 7 p.m. In addition, I take a carbidopa levodopa extended release 5200 at bedtime every night. Hopefully that gets me through the evening. And if I need to, if I'm struggling or I need an extra kick or an extra boost, I go back and I can take in between my blue pill dose, I can take the original 25 100 tablet that I started on way back when. 5 years ago, when I was diagnosed, I was actually taking a half of one of these pills twice a day. So, as the medication has become less effective, I've heard people explain it both ways. One is Parkinson's is a progressive disease. So even with the medication, the disease progresses and your symptoms get worse. And there's some folks would say that the body gets used to the medication and it no longer becomes effective. Probably some of both, but anyway, as I entered the DBS protocol, I wanted to kind of keep a journal or a record. I thought about writing about it, but I thought this would be a good subject for videos. Maybe this old dog can learn a new trick or two. Reason is to undergo DBS, you have to pass 2 evaluations. One is a physical evaluation, and one is a psychological evaluation. So my physical evaluation is tomorrow. So for the physical evaluation, you have to be off your carbidopa levodopa, your Parkinson's medications, for at least 24 hours prior to your evaluation. So it's 12:47 right now. I took my last carbidopa levodopa pill at 11 o'clock, so I'm pretty much right at the peak of my 4-hour cycle. So wanted to get a picture of what I look like and when I'm on medication. So to paraphrase the old public service announcement, this is Steve on drugs. So right now, my left hand is the one where I usually have tremor issues. Right now, there's not much of a tremor, as you can see. We'll check back later. You can see that I do have a tendency to roll my shoulders, perhaps roll my head. That's a side effect of the carbidopa levodopa. So you'll notice as People on Parkinson's, as the disease progresses and the medication is increased, they have a tendency to move their shoulders, move their heads. I forget. I should have looked this up and wrote it down before I started, but it's something kinesia. There's a lot of kinesias: bradykinesia, dyskinesia, all these movement type issues, but it's one of those. So we just simply call it wiggles. So to control the shakes, you may have to get a few wiggles. And then once the medication is no longer controlling the shakes for the entire 4 hours and you're getting the wiggles, basically you need to move on to the next step. And for Parkinson's folks, that's DBS is the next option. So my intent is to take another video several hours from now after my meds have worn off and see if there's any visible change as far as tremors or kinesias or anything else. A lot of the Parkinson's symptoms are not visible, readily visible. Things like fatigue, general malaise, apathy, it's called, or you just don't feel like doing anything, even things that normally you would enjoy. So those are not going to translate well to video, but I thought the tremors or lack of and other kinetic or kinesias might show up well. So we'll see. Be back in a few hours and do this again and see if there's any kind of a change. That's all for now.